Hey guys, so I will be blogging about my recent foot surgery that I had on Friday, August 5th. Like 2 weeks ago, I think it was, I went to a podiatrist because my left foot was hurting. Like my bone was hurting so much. And the doctor, she checked my foot and she's like, yeah, you have a Tailor's bunion, and which I already knew that I had one. And if you don't know what's the Tailor bunion, that's like, let's say this is your fifth toe, the baby toe, the small toe, and the bunion starts growing from here, and it's just a little bump. And the reason why they call it a Tailor bunion is because the actual scientific name is a buniette, I think. But if you know what's a tailor, right? They sew clothes. So instead of putting their foot flat, they just flip their foot, and this is a small toe, and then they create like a pressure on their foot when they're sewing. So I did notice that a pattern with myself, that whenever I sat, I would flip my foot. So throughout that, that takes time, progression for it to actually create a bunion. So I guess for years I was doing this until now that I started to experience the pain. I have a high tolerance of pain, so I tend to block pain, but I know I had to get that treated or see what I can get as a treatment. So my doctor was like, you have a bunion as well. And I'm like, in my mind, what? Question mark? A bunion on my big toe? Like how? I don't see it. And then she looked at my toes, and yeah, you do have deformities on your toes. You have hammer toes. I see you have like 2 hammer toes. Now about the hammer toes, it's usually caused by proper shoe size. So if it's too tight, it's going to create a pressure that instead of your bone being straight, is going to start curving down. There's like 2 different types, I think, of hammer toes. Like one is just like curvy, and then there's like gets like this bad. No, mine was like this. So she took x-rays of my foot, actually of both of my foot, because when she looked at my right foot, she said, oh yeah, you do have a Tailor's bunion here, you have a bunion as well, like again, and deformities on your toes. It doesn't sound that bad. If you hear like deformity, oh my gosh, like no, like my cases was a very mild case. So she took the x-rays, and clearly on the x-rays you can see that the bone is not aligned straight. So imagine this is your foot, right? This is your big toe, this is your small toe. So in my situation with the big toe, with the Tailor's bunion, this is my little toe, and this is, instead of, and the toe that's next to it, instead of being like, straight together, it was like a gap between these two, right? And same situation with the big toe and the toe next to it. Instead of being straight, it was like a big gap. So clearly you can see that I had bunions, and I had to get that fixed. My doctor, she's like, there's nothing that I can do but perform surgery. I perform surgeries on Fridays. Not this Friday, I won't perform surgery. I went on a Tuesday, so that Friday she was not doing any surgery. She's like, I'll schedule for a surgery next Friday, which is August 5th. Fast forward to Friday. Moving forward, my doctor was going to just do local anesthesia. but at the same time they were going to sedate me because, you know, it's a foot surgery is very painful. So they sedated me. It took like 1 or 2 minutes when I started to feel drowsy, and then oxygen, boom, I napped for I don't know for how long. I think it was like an hour and change. The best nap that I've taken in 9 months. I have a 9-month-old baby, so that felt really good. I woke up, I was fine. I was very sleepy, and I guess those are the side effects of sedation. Like, you know, when you're drugged, you're still sleepy. But my mind, I was fine. Like, I remember everything. They gave me instructions, and my sister was there, so I'm glad, because, you know, I don't grasp everything like that. Like, my memory is just terrible. So they were explaining to me and my sister like what are the things I have to do. So they gave me a boot that's to wear outside, and they gave me a shoe to use to walk at home. And they also gave me a kind of like a condom, it looks like a condom, shower protector. So you put in your foot inside the shower protector, and it goes from your foot all the way to your knee, and it seals your foot, your leg, so that way when you shower there's no water dripping inside your foot. Or and maybe if there is a drip, you know, it's gonna be minimal, but you have to be very careful, you know, not try to get your foot wet. But in my case, I took a shower, it was fine. I just didn't really like the fact that I couldn't take a long shower, and it's not fun because you can't really put pressure on your foot. So that was not fun. So right now I'm on my 3rd day of recovery. I haven't experienced any kind of pain. They numb your foot so, like, incredibly, so you won't feel anything until like the 2nd day, like towards the night. And what I was feeling was just like some pressure, you know. I guess like my foot is swollen, which is normal. And when I walk now, like I feel some kind of pressure. I wouldn't say pain because it's not painful for me. Like I mentioned, I have a high tolerance of pain. So they prescribed Vicodin and 800 milligram of ibuprofen, and I have not taken any of it. You know, I'm good. I think the reason, I'm not sure why. Maybe it doesn't hurt because either I have high tolerance of pain, or because my situation was mild. I think that my doctor, she just shaved the bone. She didn't cut bone. I think that's what she did. When we had the conversation about the surgery, I have some screws on my toes, you know, to keep the toes straight, and then they will come out. I'm not sure when. Maybe I don't know how many weeks. I know that based on videos that I've watched and some research that I've done, then the second follow-up, I think it is, or the first follow-up, I don't know. I'll see my doctor in 2 weeks. I think my stitches will be gone by then. Like, she's gonna remove them, I think. So we'll see about that. So my doctor called me the following day just to check on me, you know, asking about elevating my foot, you know, icing, etc., etc. Next Friday I'll be getting my right foot done as well. I'm gonna get surgery. My right foot doesn't hurt or anything like that, but eventually I know it will happen, just like with my left foot. So might as well just get that done. and, you know, have my foot fine again. I go back to work in September, so I'm currently on vacation. I am a teacher, so the week that I go back to work, my boot comes off, so I should be fine with that. I'll have a week extra with the right foot with the boot. And I'm hoping that my healing process, it heals fast. I think it will heal fast because my case is not severe. I have it's a baby mild case, and my doctor, she specializes on making minimal invasive incisions. In other words, they just cut like 5 millimeters, and they use like a x-ray computerized, like with a computer, and they just like look at the computer monitor and just perform the surgery, unlike older bunion surgeries where they actually cut your foot, break your bone. I don't know if they still do that. I'm pretty sure they still do with people with severe cases. My case, again, very mild. So I'm gonna get surgery next Friday. That's August 12th. And then August 16th, I go back to see my doctor for my left foot. So I'm hoping it turns out well. I can say that because I've had an injury on my left foot like 3 years ago, a really 3rd-degree sprained ankle, and let me tell you something, surgery is better than a sprained ankle. They say it too, that if you break a bone, the healing is faster, and you sprain and you can walk. I can walk, just you can't be on your foot all the time. Unlike a sprained ankle, you can't walk, you can't put pressure on your foot. That's what I meant by that. So I will be blogging about my next follow-up appointment with my doctor, and just let you guys know, if you want me to blog about my foot injury part 2, just thumbs up, like the video, so that way I know who wants to watch, or wants to get more of an idea of my recovery. Just like the video, subscribe. If you have any questions, feel free to ask, and I'll be glad to help answer the question, your question. Also, since I am laying in bed, I will be making another video on my recent LASIK eye surgery that I got, like 3 days before my surgery, my foot surgery. So I'll be making another video, because I'm just here laying in bed, and so you will see me with the same clothes. So now you know that I just made a second video on the same day. Thanks for watching. Comment, like, subscribe, and I'll keep you posted. Bye guys.